Okay. Uh, Good morning, good afternoon, good evening, wherever all our attendees are. First of all, I would like to extend a very warm welcome to our, uh, collaborator, Professor Dilip Mavlankar from Indian Institute of Public Health, Gandhinagar, and our panelist, Dr. Valentina Baltak, who's our colleague from WHO headquarters in Geneva, Dr. Aisha, who is from Sri Lanka and is working with the ministry and has a long-standing experience with dealing with adolescent health. Dr. Atnafu, who is our colleague from UNICEF and will be joining very soon. And Dr. Rajesh Mehta will be moderating this session today. So, as some of you may be joining for the first time this webinar, I'm Dr. Neena Raina. I'm Senior Advisor for Maternal, Newborn, Child, Adolescent Health and Aging in WHO Regional Office for Southeast Asia. We have, which is I'm looking after, along with a very, very able team, the whole life course, which, we say from pediatrics to geriatrics. And I think this is a wonderful opportunity for us to really be, sharing some of our thoughts. And we have got a wonderful panelist for every webinar. So, as you know, this COVID pandemic, we are almost 8 months into this pandemic, and there are, countries which have really suffered a lot. In our region, the impact, direct and indirect impact of COVID has been great. Direct impact we all understand on the survival and sequelae later on, and on indirect impact is on the sexual reproductive health, maternal, newborn, child, adolescent health, and aging, access to essential services. And this access to essential services, has been affected. And as a result, the indirect impact has been on the coverage of essential health services throughout the life course, and to the especially to the most vulnerable population, which is women, children, and adolescents, and also aging people. The people who are older, adults, suffer from the direct as well as indirect impact. So we, in collaboration with UNICEF and UNFPA and WHO in all 11 countries of our member states, we tried to see what has been the impact of indirect impact of COVID-19. We have produced some guidelines as well jointly, which have been shared. So the indirect impact on coverage of services and on survival is quite evident. And the reason can be both provision side as well as demand side. People are scared of going to the hospitals because they fear getting infection. There is a phobia, there is a lot of fear around that. And a provision side, as are most of our health workers, have been repurposed at times for COVID, responding to COVID-19. I think our health systems are also getting affected. You must be seeing growingly, especially during lockdown conditions, our health system preparedness was further enhanced. But then there is so that when the lockdown opens, the surge of cases can be managed. So as a group, we are now going to be, this is the third webinar. You can see on the screen, there are 11 webinars which we are going to be, we have planned as in collaboration with IAPH, Gandhinagar. There are 3 on adolescent, and today is the first one on impact of pandemic and lockdown on adolescent health and well-being. There are 3 on healthy aging. We had last Wednesday, every Wednesday on a fixed time, which is India time of 1 p.m. We'll be having these webinars. The dates are mentioned as well. So there'll be 3 on aging. There will be on maternal reproductive health. There will be 4, which have been listed here, and 1 on children, which is COVID-19 in children, which already was held as the first webinar. So this is what we are, we plan to do in collaboration with Indian Institute of Public Health, Gandhinagar, and very glad to have Professor Dilip Mavlankar and their team collaborating with us to organize these webinars and making sure that people get the information as well as presentations, as well as these webinars are organized without much problem. So I think I know there is a webinar fatigue. We all keep getting information, this webinar, that webinar. But then, ours are technical webinars where we try and bring on board as panelists, we bring on board all the people who are experts in this area and who can really address some of the questions and some of the concerns which have been which you put across, which will be addressed at the end of the presentation. So I warmly welcome all of you to this webinar, the third webinar of WHO-SEARO and IIPH Gandhinagar, the third webinar on impact of pandemic and lockdown on adolescent health and well-being. And I'll now request Professor Dilip Mavlankar to say a few words before we hand it over to Dr. Rajesh Mehta, who's a regional advisor for child and adolescent health, to really moderate the session. Over to you, Professor Dilip.
Thank you very much, Dr. Neena. It is a great pleasure and privilege for Indian Institute of Public Health to partner with WHO Regional Office for Southeast Asia to conduct this series of webinars. This is the whole spectrum of the webinars will cover the life course. We started with the webinar on the children, then with old age, and now with the adolescent health. And as the countries look at opening of schools after the lockdown is opened, this is a very important area where I'm sure the experts will enlighten us. A few words about Indian Institute of Public Health. Indian Institute of Public Health Gandhinagar is a partnership between Public Health Foundation of India, National Foundation, and the provincial government, state government of Gujarat. We are an institute and school of public health. We run Master of Public Health and Master of Hospital Administration full-time courses, also short-term training programs, as well as other educational and research activities. Our faculty also work closely with the state government and national government on many issues, including COVID. And that is where we thought that this series of webinars will really help a lot of people, our students, our alumni, faculty, and the professionals who work in this area. Lastly, this is a very unprecedented times, and nowhere in known history of recent times such a lockdown has happened, which has affected the lives of billions of people, not billions of people, in very different ways. And as we are coming out of these lockdowns, we have to see how we work with and ensure the safety of children and adolescents and unlock the activities so that all the economic, educational, and other health services open up. So I'm sure the experts will provide us with very useful guidance, which is very, very timely. With that, let me thank WHO again, and I request now Dr. Rajesh Mehta to begin the deliberations.
Thank you, Dr. Dilip. Over to you, Mehta, to take us through.
Thank you, Dr. Raina and Dr. Dilip, for setting the stage for us. This is the third webinar, as we were told. And today we are exploring this concern about a big section of population, which are especially vulnerable, adolescent population, which is easily 20% of the population in many countries of our region. and they have been affected, as both speakers reminded us, directly and indirectly because of the pandemic, the virus, and the effects of closure of health, nutrition, education, and social services. So we will go through a series of 3 presentations today. First, to understand the impact itself, how it impacted the people, the adolescents. The second one on what are the health issues when we reopen schools. And third, we will have some experience sharing from Sri Lanka, who's already reopened and has learned the way of doing it well. So we will have the benefit of all these 3 presentations today. So first one in my series is Dr. Valentina Baltag, my colleague from WHO headquarters Geneva. She is responsible for this adolescent health program from there, and she will, in next 15 minutes, try to tell us about the impact of this pandemic on physical and mental health and well-being of adolescents. I have one announcement, that questions will be taken in the end. The attendees are kindly requested to keep writing their questions in the QA box, and we will accumulate them, and we will take the questions at the end of 3 presentations. Thank you for your attention and cooperation. I welcome Dr. Valentina for her presentation. Thank you.
Thank you very much. I'm very honored to be able to contribute to this series of webinars. And in my talk, next slide, please, I will discuss the physical, mental health, and social consequences of this pandemic and how it affects adolescents. So it's a broad topic, and when we talk about physical health, first of all, is what is the latest data about COVID-19 infection in adolescents, in children and adolescents. And then there are some other issues that I will touch upon, which is disruption of nutrition and physical activity, violence, disrupted immunization, and other essential services, female genital mutilations. Now, there are dire social consequences of the pandemic on adolescents in general. And for example, school closures is one of the biggest social consequences. And in turn, school closures have their own consequences, negative. Social isolation, child abuse, online harassment, and adolescent pregnancy and child marriage are some of the other social consequences that are not to be neglected in our pursuit to try to reduce transmission. And then all of these impact in various ways mental health, and we have seen the rise in mental health problems in this population. Next slide, please. So what do we know about COVID-19 in children? We know that notification of disease in children below 18 years account for only from 1 to 8 maximum of all cases globally, and this is consistent across regions, across countries. And when you compare that the proportion of this population makes up 29% of the world's population, then we can see that children and adolescents seem to be less affected by COVID-19 in children. With the caveat, though, that the cases are being identified after testing, and most of the policies is about testing symptomatic individuals. So we don't know how many of adolescents are asymptomatic, but at least from the notifications, we can see that they are less affected. Now, in relation to COVID-19 in children and adolescents, the 3 questions that matter is, do they get it? If they get it, how severe it is? And if they get it, then do they transmit it onwards? And also, what is the likelihood of death? So the next part, the right-hand side of the slide shows that among children and adolescents, case fatality ratio is very low as compared to other age groups. But in children below 18 years old, the highest is for children under the age of 5 years. So that allows us to conclude that available evidence suggests that children and adolescents are less likely to suffer severe clinical symptoms resulting in hospitalization and death. Next slide, please. Now, other physical consequences on the health of adolescents might result in part because of the disruption of essential services. And in a survey that was conducted with a sample of countries where we asked what are the most frequently reported service disruptions, you can see on this slide what are the top 10 services that were discontinued or not provided with the same intensity as before the pandemic. Next slide, please. And among this list, I highlighted in yellow, next slide, please, for your easy reference, those that directly impact or have relevance for children and adolescents. Next slide, please. So you see that routine immunizations is a service that is geared at children and adolescents, mostly NCD diagnosis and treatment, family planning and contraception, treatment for mental health disorder, and sick child services. Quite a high proportion of countries did report disruption of those services. When we look more specifically at services that serve uniquely children and adolescents, school-age children, then we see that the disruption of school-based or school-linked essential services is also of consequence. For example, school meals, mental health services, speech therapy sessions, peer support groups, immunization, other sexual reproductive health services. For many children, let us not forget those services, the only source of accessible services are school health services. And when school will close, if they do not have access to those services, then they might not have an alternative way of accessing those services. Next slide, please. We also know that there is an increased risk of violence for women and children. And this increased risk plays out through various avenues. One is that the stress, the disruption of social and protective networks, loss of income, and decreased access to services all can exacerbate the risk of violence for women and children. And in many countries where people are encouraged or required to stay at home, the risk of intimate partner violence is likely to increase. And indeed, we see such increase. Reports from across the world suggest a significant increase in domestic violence cases related to the COVID-19 pandemic. And also because of the circumstances that families, individuals, and households find themselves, there is a reduction in the rate of survivors seeking services. And this might be due to a combination of lockdown measures and not wanting to attend health services for fear of infection. Also, as I have shown in the previous slide, the essential services are being disrupted, and the reduced access to sexual and reproductive health services is likely to be more limited, and other services such as hotlines, crisis centers, shelters, legal aid may also be reduced, making it difficult for women and children and adolescents to access the few resources of help that would usually be available. More on this topic you can find in this brief, which outlines what the problem is, why the problem is occurring, and what might be the mitigating measures. And the link is provided on the bottom of this slide. Next slide, please. And some modeling studies suggested that the impact of COVID-19 pandemic might have a dramatic increase in, on the one hand, unmet needs for family planning, also an increase of child marriage and female genital mutilation. For example, if for every 3 months of lockdown, there is an assumption that up to 2 million additional women may be unable to use modern contraceptives. And among those women, many will be adolescents, because adolescents are even more disadvantaged for many reasons in accessing contraceptives. If the lockdown continues for 6 months, that it will be 7 million additional unintended pregnancies are expected to occur. Again, many of them will be in adolescence. For the child marriage, the figures are staggering. An additional total of 13 million child marriage will take place that otherwise would not have occurred in the next decade. And for female genital mutilation, we might expect 2 more millions of cases of female genital mutilation that will occur over the next decade. And this is because the pandemic disrupts the planned effort to end child marriage and female genital mutilation. Next slide, please. This is a slide and an interactive map from the World Food Program, and the link is provided underneath of this slide, and you can, it is regularly updated. So what you can see here, that in 161 countries that have had school closures at some point, more than 300 million children did not have access anymore to school meals. And again, let us not forget that for many disadvantaged children, school meals were the only daily source of secure meal. Next slide, please. I put here a collection of the very recent studies that look at the impact of COVID-19 pandemic of physical activity and sedentary behaviors. So one study is from China that looks at the sedentary behaviors of 18-35 years old. Then there is a multi-country study from Italy, Spain, Brazil, China, Colombia, that looks specifically at adolescents 16 to 19 years old. There is a study from Canada looking at 5 to 17 years old children and adolescents physical activities, and compares the levels of physical activities during pandemic with the levels before. There is a study from Australia that looks at young people, also looks at the level of physical activities and compares with the previous levels. Well, guess what is common in all those studies across so many countries? The common is the conclusion. There is a dramatic reduce in the level of physical activity and an increase in sedentary behaviors. Next slide, please. Sometimes we forget that socialization is not merely an entertainment for adolescents, but it is part of adolescent developmental process. So in other words, being together, being within peer groups, socializing is something that adolescents need for their normal development. And when the relaxation of confinement measures has happened in many countries, adolescents and young people made headlines. And we also saw this in the statistic that the proportion of those infected aged 15 to 24 has risen threefold in about 5 months. And one WHO official pointing to this data, kind of encouraged for young people to ask themselves, do I really need to go to that party? The ensure and do socialize is an important public health consideration. Next slide, please. Next slide, please. So mental health, what do we know about the mental health and psychosocial support for adolescents in times of COVID-19? We know that 40% of the youth have tendency to have psychosocial problems during COVID-19, and they manifest themselves in feelings of loneliness, nervousness, restlessness, irritability, difficulty concentrating. Next slide, please. And now it's clear that mental health and psychosocial support should be integral and cross-cutting to public health COVID response. And the key messages from this policy brief, COVID-19 and the need for action on mental health, is that we need to apply a whole of society approach to promote, protect, and care for mental health, ensure widespread availability of emergency mental health and psychosocial support, and using this as an opportunity to build mental health services for the future. Next slide, please.
So Valentina, please, last few minutes now.
Yes, thank you. What are we doing for adolescents needing support? Because mental health, or rather the COVID pandemic situation, will be with us for some times. So mental health in times of COVID is the new normal. And in the remaining parts of my presentation, I will point to some existing resources that you can access to see what is being recommended. Next slide, please. So we have resources for adolescents, and this is how to cope with stress. For example, we have Q&A for adolescents using COVID, doing what matters in times of stress, an illustrated guide, and other resources that are related to mental health. You can all access them on WHO website. Next slide, please. We have also resources for parents, how to support, and this is examples of infographics, 9 infographics on 9 tips, and here are some in the slide you see some illustrative examples. Next slide, please. We have resources for parents and teachers. Next slide, please. Resources for healthcare workers. Next slide, please. Again, they are all available on WHO website. Here are some examples how those materials were used in countries and national adaptations were made. Next slide, please. And coming soon is the Helping Adolescent Thrive Guidelines and Toolkit. It will be available this autumn, and it looks at several issues such as mental health, substance abuse, sexual and reproductive health, self-harm, interpersonal violence, and it has an intervention guide that guides us through a set of skills that might be built at the individual and household level, such as interpersonal skills training, emotional regulation, stress management, and problem-solving skills. Next slide, please. So I encourage you to use all those resources. The links are provided, and I will be very happy to answer the question that will follow. Thank you very much for your attention.
Thank you, Dr. Valentina Beltag. Thank you also for reminding us that there are 1.5 billion learners across the world, more than 1.5 billion of them affected by the closures because the society went into lockdown, and with adverse impact on physical health, on chronic care issues, with the nutrition, psychosocial well-known. But we are also surprised to understand that there are social impacts beyond that early marriages can happen. And you are right, actually in India, we saw a report from one of the states that since the girl was home away from school, parents found the best time to marry her. So therefore you are, pointing out to so many social issues as well. So thank you so much. And you gave us a lot of resources which are useful for healthcare workers, for parents, for teachers, and for adolescents themselves. So I hope our audience will get these slides and they will have the access to these resources. Thank you so much. So it's now my pleasure to invite Dr. Ratnafu Asfa, the health specialist from UNICEF South Asia Regional Office from Kathmandu. And he has kindly agreed to use the next 15 minutes to tell us about the health issues as we start reopening these schools. Thank you, Ratnafu. Your time starts now. Thanks.
Thank you, Rajesh, and it's really an honor for me to speak with all of you on this important issue. As Professor Dilip noted at the beginning, many places are now looking for reopening schools as it's becoming an imperative need. So, given that we still have the pandemic ongoing, which was the cause for closure, it's only expected for us to actually deliberate on as to how we do that. So that schools are open, but opened actually safely. So here we are not to discuss on the value of opening schools for adolescents. That's well argued for. So we are rather trying to outline the how, looking at it from the health perspective. So that's the topic for my presentation. If you go to the first slide, please. Valentina has actually addressed the message of my first few slides using probably more robust data, but just to go through some quick evidences so far, the jury is still out on susceptibility of adolescents for COVID-19 infection, but for sure we know that they are not immune, but available evidence suggests that people younger than 20 years are probably much less susceptible to COVID-19 infection, at least according to a couple of papers that have come out over the past months. On top of that, even when infected, we know that they are less likely to be symptomatic, perhaps only 1/5 becoming symptomatic, whereas the chance of being symptomatic actually increases with age, reaching to about 70% by the time we reach somewhere around the age 17. However, adolescents are noticed to pose the same level of transmission risk like older individuals, meaning a younger and an older person infected are equally likely to transmit it to the rest of the community. We do have some other papers that talk about less risk of transmission in younger children. Next slide. This was what came from a nationwide survey in Spain, and showing us, confirming basically seropositivity for COVID-19 actually increases with age, reaching some level of higher plateau around the age of 40 plus. I put a green line on the peak for adolescent, for younger than 20, which is around 4%, but everybody else that's older is, as you see, is actually having a higher positivity rate. Next slide, please. If you just focus on the adolescents, leaving those above 20, we noted that infants, as well as those above 10 years, are more likely to develop severe diseases. This is from a European study that was done across about 25 countries. So those between 2 and 10 years appear to be faring better. Next slide. In our region, again, similarly, adolescents actually account for a much smaller proportion of confirmed COVID-19 cases, less than 5% in the case of Sri Lanka, or even in a higher share scenario where we do have in Nepal as high as 20%. Knowing that this age group actually accounts for a higher proportion of the population, we can for sure say that at least adolescents are less likely to be diagnosed with COVID-19 infection in the region as well. Next slide. What about schools and COVID? As we all know, when the outbreak hit, schools were among the first to be closed. Not because we knew, rather because we did not know what will happen if schools remain open. To be fair, we knew schools create an environment suitable for a spread of respiratory infections anyway. So it was like a common sense decision to close the schools. Of course, we do understand what's happening with the schools closed, basically from a learning perspective at least. Some closed with alternative learning, like even if it's suboptimal, others without, obviously widening the equity gap that already exists in our societies. Since then, from varying policy interventions implemented across the countries, we do have, some evidences from observational studies on possible role of school environment for the spread of the infection. I've picked a couple of examples from papers I saw and want to present a little more detail on this slide. Maybe next slide, please. The Center for Global Development, as part of its tracking COVID-19 related policy interventions, documented that school opening did not actually change the disease transmission trend, with few exceptions. Countries often decided to open schools when they noticed that the number of new cases either was on the downward trend or has stabilized. We can see that in most countries, the downward trend continued, as you can see for countries like Germany, Netherlands, France, and so on. Madagascar appeared to be a top outlier in a sense that after school reopening, cases started to increase and continued to increase. There were also some increases in Vietnam, which were quickly controlled, and some increases also noticed in South Korea. Next slide, please. But perhaps the first, some sort of bold warning on schools and COVID transmission came from Israel, after the country decided to open schools in May with recommended mitigation steps. 10 days later, a couple of schools reported outbreaks, especially affecting those in grade 9. As you can see in the graph, as high as 1/3 of the grade 9 children were infected, and also those below grade 9. 10 to 12 having a little lower rates. Here, looking at the implementation of mitigation steps, it was noted that the level of crowding, use of masks, and air conditioning style used were all less optimal. All in all, it was quite a lesson for us, including on pitfalls of opening too soon without having the safeguard measures assured. Next slide, please. With that outbreak, it was not only that the report came from 2 schools, but a shift was also noticed in the city, Jerusalem, where this outbreak happened, in the age group of COVID-19 cases in general. What you see as the red tall bars on this graph is for school age 10 to 19, which became much taller after the school reopening in mid-May. We can also see, when comparing it with the rest of the country on the right-hand side, that group accounted for a higher proportion of cases in Israel. Next slide, please. Rajesh, are we together? Yes.
Yeah.
Thank you.
Lag time.
In the United States, they did an analysis of the effects of school closure on the epidemic nationwide by comparing areas where the schools remained open with those that were closed. They concluded that school closure was related to a significant decline in community transmission and COVID-19 mortality, up to 62% reduction with the schools closed. So note that with all the instances we mentioned here are quite observational. A number of other mitigation factors were also in play, but still we can say that schools pose a risk of increased transmission, and school reopening with safety requires a very deliberate action. Next slide, please. So how should we do it? Maybe if you go some 3-4 slides, this was supposed to be a bit guided, but please go 3-4 more slides. 3-4 clicks, I mean. Many organizations and governments have been working with focus on school reopening and outlined mitigation measures. If we just see those around the UN, earlier in April, 5 global agencies came with a framework for reopening schools. WHO gave us school-related public health measures in May. And another relevant guide that came from WHO in August was use of masks in children. Most recently, 3 UN-affiliated organizations expanded the scope and came with a guidance on safe and healthy journeys to school. Next slide, please. The latter one, the guidance on safe journeys, actually focused on transport and outlined some 10-point steps to reduce the risk of COVID infection, as well as reduce traffic accidents, which is quite worrisome for adolescents, and air pollution. Next slide. In UNICEF, we do have some sort of a position statement that underlines 3 principles for school reopening: detailed policy, guideline, planning and implementation, informed by local transmission pattern, and taking into account the best interest of the child, along with public health considerations. We insist at looking at both sides. Second, where schools remain closed, we need to focus on equitable access to continuity of services that includes learning, health, nutrition, and others. The third is a recognition that when we do reopen, we are not in a situation to return to business as usual. The way we do learning, like many other things, will be significantly different. Next slide, please. So on that line, in the region, we have produced a checklist working with partners for school reopening and availed it for use by countries. It has details of health and other relevant issues to be considered at national and subnational level, starting with guideline development as well as at school level on planning and implementation. Next slide. But for our discussion today, focusing on the health issues in school reopening, the frontline actions boil down to as to how to implement the now sort of standard mitigation measures, but in a school environment. Top on the list is wash facilities and hand hygiene. To be able to run schools safely, staff and students need to have access and utilize wash facilities, practice respiratory and hand hygiene, combined with maintaining clean and disinfected school environment. It requires infrastructure, procedures, supplies, as well as behavioral change communications. Next is mask use. As per the WHO guidance, children 12 years and older, please, sorry, just one slide back. 12 years and older can use masks just like adults, which is again an issue of supply, procedure, and enforcement. Then comes physical distancing, which is actually much easier said than done in a school environment. It really requires a lot of innovations and coping mechanisms, starting with the school size, considering outdoor classes, increasing space for specific activities that require more excelling, managing hallways, mealtime safeties, school buses, treating them as extension of classrooms, including cohorting, and so on. I mean, we don't really have a one-size-that-fits-all solution, but we want to emphasize that thoughtful local planning will be required to come up with innovative solutions to implement physical distancing. One more important action is the screening and management of students, teachers, and other staff. That includes guidance on staying at home if unwell, having contact, or even when they do have contact with a COVID case, daily screenings, as we see it in some of the schools being implemented, school return policies for children recovering, as well as those with contacts and the like. All these outlined guidelines with a risk-informed decision-making checklist that needs to be implemented faithfully. Next slide. Of course, we do have some other steps to implement as well, other than these 4 basic ones, which includes communication with the school community in general, so that they understand the guideline and also plays a role in maintaining a safe school environment. It may include limiting the usual parental access to school compound, for example. I want us to talk about a bit on targeted closure. Sometimes it may be required, maybe because the schools are stretched due to teachers' absence from illness or absenteeism, or maybe it's part of a strategy to reduce the school size. In each case, we need to come up with prioritization mechanisms. So one thing we want to underline is, for some critical workers like healthcare professionals or essential workers, children being in school could be the only way for them to do their job and control the outbreak. So we need to consider such issues when we do bring some of them to school while others are still kept at home. But in all planning and implementations, we need to consider teachers and children with comorbidities, children with disabilities, and specifically marginalized children who will not only miss school if they are at home, but also their nutritional support, as Valentina mentioned, protective environment, some who may otherwise drop out of school for different reasons. So we need to have detailed scenario-based plan implemented and monitored to avoid the impacts of school closure. Next slide, please. So in conclusion, schools are important for health, but we need to reopen them with safety, with full awareness of the risk, best possible mitigation strategies to protect the school community in place. And for this to happen, funding and supporting schools for safe opening is quite essential. Knowing that we are not going to rebuild schools or refit them, improvisation will be the most feasible way forward. That works if we engage the whole school community from planning to execution and monitoring. In all these endeavors, WASH provisions appear to be perhaps the greatest priority, and especially for our region. This is my last slide. So here I want to leave you with education first motto of Malala. Thank you for your attention, and looking forward to hear more experiences. Thank you.
Thank you, Dr. Ratnafu, for reminding us some good practices which can prevent the adverse impact of reopening the schools in terms of additional infections. While the evidence may still be coming up, I think there is a strong case to implement what we know works already in all school settings, and to achieve both the educational objective as well as the health objective, which is to keep the health of children and teachers and the whole school community, the staff members, everyone, that they are safe in terms of health. So therefore, the checklists, the guidelines, the checklists are important. And also then you said the monitoring once the schools reopen, that we should be able to monitor the health and educational objectives in this scenario. So therefore, it is important to follow the guidelines, the checklists, and the monitoring. So there are ways to reopen. Thank you so much. And now we will hear from one of our member states. Sri Lanka has recently reopened the schools after closing down. So I have the pleasure of welcoming Dr. Aisha Surya for sharing with us the Sri Lanka experience of closing and reopening the schools. And hopefully we will have some lessons learned already. Over to you, Dr. Aisha.
Thank you. Good afternoon. I would like to thank both WHO and Indian Institute of Public Health for giving me this opportunity to share the reopening plans and the experiences we got. Next slide. Ministry of Health together with Ministry of Education have overcome many health challenges during from 1980. It's a very long relationship. Next slide. Present situation, confirmed cases 3071, under medical care 180, recovered 2879, deaths 12, infection among 5 to 19 age group 95, and this is the geographical distribution. It's in 13 districts out of 25 districts, and it is mainly in Western Province. Next one. Next slide. Proportion of children is only 3%. Next slide. This is the timeline. 11th March, appearance of the first local case. Then 12th March, closure of all the schools. And total lockdown on 17th March. And reopening of grade 5, 11 and A-level sections on July 6th. And again, due to the second outbreak, the high incidence in one of the rehabilitation center, we had to close it again 13th July to 27th July. Then again reopen in 10th August. Next slide. So during the closure, lot of challenges faced by teachers, parents, and school children. So those are actually interrelated. When we take parents, loss of income, difficulties in facilitating online learning, problems in providing food that children are used to because it was delivered to homes, so they can't go and buy. Coming to children, they have a lot of issues with regard to curriculum coverage, loaded with assignments. Early stage, they had company of parents to help them, but later they have problem with because of the old people who are at home can't facilitate them. Then restricted outdoor activities was a big problem. For teachers, covering syllabus, difficult to have practicals with online teaching, lack of motivation of children for distant learning. Next slide. To overcome those challenges, initial stage, we concentrate on mainly family health, about parenting, issues of adolescents, mental health issues, sleep, and various issues which are related to family health in the initial stage of lockdown. In that period, at the same time, we prepared the guidelines for school reopening because it needs a lot of time to ensure the facilities. And then Education Ministry prepared a comprehensive guide following our guide. Next slide. At the same time, the supportive guidelines are also developed for transport of school children and dry rations distributions, because instead of midday meal, education gave the food pack for the children. Before schools were open, next slide, sorry, next slide. Before schools are open, short video clips on preventive activities in schools were aired. That was useful to remind the people about how to prepare their children for the new normal environment. Next slide. That was the videos we prepared for the preparation of a school child for the new normal environment. Next slide. Implementation of guidelines. mainly through the health promoting school committees, which were at provincial and zonal and divisional levels, and they were involved in implementation. And also awareness programs are done by our public health staff to the school principals. Next slide. Main infection prevention and control measures addressed at school were adoption of physical distancing, which was a bit difficult, facilitate hand washing, maintain respiratory etiquette, maintain the cleanliness of the places where risk of contamination with respiratory droplets and body fluids. Next slide. So these were the people who gave us resources, maybe financially or technically, government, WHO, other UN agencies including UNICEF, World Bank, ADB, and well-wishers. Next slide. Next slide. Monitoring of school reopening process. Final assessment was done by MOH. Preliminary assessment was done by school health authorities, provincial, zonal, and divisional level. So after the final assessment, the schools are ready. Epidemiology unit gave the green light for the opening of schools. They assured that community spread is not there. Next slide. So that was the opening of schools. So at that time, we were really educated parents, teachers, and everybody how to safeguard our school population. Next slide. So in school opening, we did it in phases. That is 29th June, we get down the staff only to prepare the place, and 6th, that is after 6 days, schools were open for only 3 grades, that is facing various national level exams, that is GCE O level, A level, and scholarship, year 5 scholarship. So the second phase, 10th August, in that actually all the grades were open, but they were only for 1 or 2 days per week. So because we want to keep distancing, we had to divide the classes into 2 and do the educational activities. Next slide. Challenges after reopening. Adapting to new IPC practices of new normal phase of COVID-19. As I said earlier, physical distancing was difficult for primary children because they used to wait in their classroom till 10 o'clock, and after interval they come and sit with their friends. So though the class is divided. So difficulty in scheduling the main government examinations, difficulties in attending group activities, mainly the physical activities and the laboratory practices and extracurricular activities. And we couldn't open canteens because of the, we were scared whether children are not wearing masks when they eat, and they will get together and do it. So we didn't allow them to open the canteens. Different school closing times for different grades. This created a little bit of a problem for parents to picking up children because they want to cover the syllabus. They had to extend hours for older children. More children found to be overweight according to teachers. So we will have to take some action in near future. Next slide. This is the outline of the reopening process. We started with preparation of guidelines and then infrastructure development, assess the suitability of for reopening, and we open for teachers, then we open for students. Next slide. The factors contributed for success. Policy decisions taken at committee of experts chaired by His Excellency the President. Preventive measures carried out under Quarantine Act, which is very powerful though it is old. Presence of already established system of health promoting school program which we could use to implement the preventive measures. Good communication and collaboration between Ministry of Education and Ministry of Health. Good public health system supported by intelligence services, triforces and police and media to stop the community spread. All the available resources diverted towards control and preventive measures of COVID infection. Government and well-wishers support in provision of financial and other support to needy families because a lot of people lost their jobs, especially daily earners. Continuation of academic activities as much as possible. Where they don't have online facilities, they gave some assignments and assessments through messages, phone messages and things like that. So education was fairly continued fairly okay. Next slide. Things that should not have been done. Lack of consistency in health messages delivered by different agencies. Violation of IPC measures in few occasions. Actually, one occasion when the child's report comes as weakly positive, the principal has taken a decision to close the school. So all the other schools got scared. Then way forward, now today we have opened all the schools for all the children as the normal way, and we hope this is a great achievement for Sri Lanka. And I think we need to boost the economy to sustain our free education and healthcare to face any future disasters like this. We appreciate all the technical guidance given by epidemiology unit during the COVID season. Thank you.
Thank you, Dr. Aisha. Thank you so much for this excellent talk on how did you do it. So the recipe is being better prepared, have a good strong system already. Then you had better preparation, excellency, the president supporting your work and you engaging with community. So this has worked well for you. So congratulations, Sri Lanka. I think we all learn that both in health side and education side, we have seen good demonstration of copybook style of management during this pandemic from Sri Lanka. Thank you. So now we have a couple of questions recorded in the question answer box from the audience. So the first one observation is Valentina, that in Nepal, during the COVID, they found alarming increase in suicide rates, especially in adolescent girls. This is an extreme example of how mental health well-being can be affected. So are there any particular measures for suicide prevention recommended? And what is the, generally, globally, what are the other examples of such severe impact on health of adolescents? Valentina?
Thank you for the, I think that's a striking example that we should not forget that the COVID infection is one part of the equation, and there are many other health-related considerations that we should care of. And the numbers that were provided, I don't know, the methods of this study are just striking. If we put all our society efforts to prevent transmission, and in the same time such dramas are happening as increase in suicide rates and other conditions like people not getting timely care for cancers, for other chronic conditions. So we should not be blind to that. I think by now we are very cognizant on that. And the guide from WHO that is called Maintaining Essential Services During the COVID-19 Pandemic is a good resource how to keep on, not only how to keep an eye on that, but what concretely can we do and what are the tips to maintain those services in situations when some measures, public health and social measures, needs to be implemented. So to keep this balance is very important. I do not know of any other studies that show such dramatic increase in suicide rates, but there are many studies that report that the conditions for those are in place, and this is a disaster in the making. And for example, the source that I have shown you, which is the policy brief that was published in May 2020, I have shown you the cover and I have commented that it recommends a whole of society approach. So this one makes a clear case that mental health problems is a disaster in the making if timely actions are not being taken. Now, what are the measures? What are the mitigating measures? Well, the critical services that, for example, victims of violence and sexual abuse should have access to in times of COVID should be in place, COVID or not. Those hotline resource centers, and also creating conditions for victims to being able to report the abuse from home. Because one of the phenomena that was noticed, those hotline centers, they noticed that the number of calls has decreased dramatically, but the number of calls for help via SMSs has increased. And this might be due to the fact that if the victim is confined in between four walls with the perpetrator, it might be difficult to report. So they have a double difficulty in getting access. So this should be kind of factored in measures. Keeping continuity of those services is critical, and we have now to bear this in mind. If another social measures will need to be implemented, another kind of restrictions, then we should not make the same mistake. Over.
Yeah. Okay. Thank you so much. So it is a good idea that when the schools reopen, we do support the educational objective, also the infection prevention and control. So therefore, it came again and again. There are social distancing, masking, hand wash, sanitization. All of that is important. Additionally, I think we should have psychosocial support available for children and teachers both while schools are reopened. So for Atnafu, there is a question.
Rajesh, if I may, just on the school reopening, one of the recommendations, because many of the victims of violence did not have access to support when the schools were closed. So one of the first measures is to try to assess and see the situation and encourage those who did not seek support then to have this access. And the same applies to psychosocial support for people who did not access mental health services when schools were closed.
Yeah, sure. Thank you. So we have one question on teachers' own health. If they have comorbidities, I think Atnafu did make a point that targeted exemptions or closures may be possible. If there are teachers who have comorbidities, they may be exempted to expose them to risk. So Atnafu, this is one question from the audience. And the second one is about the sporting activities during reopened schools. Aisha and you probably can guide us on that. What are the guidelines specifically for close contact sports and indoor sports, which were normal, but now in the reopened situation when COVID is still spreading? So how do we handle that? So about the teachers and then sports between the two of you.
Thank you, Rajesh. Yes, Aisha will guide us from their actual experience. But as was noted, with the first thing will be teachers and other staff members and the students. Identifying those with comorbidities will be, step number one. Then, of course, coming up with a mechanism for a localized extra protection measures for this group will be important. We can't recommend to exclude them from everything, like blindly. Again, it will come down to local planning, but the idea being giving them extra precautions. For example, if we are when we do implement physical distancing, make sure that we do it, more rigorously and with the maximum recommended physical distances. If they happen to be in the school environment, when we can, some schools may decide to give them like back office jobs, something that will not expose them to, more contacts with individuals and so on. So the basic principle doesn't change, but we need to be a bit practical. And as I noted when I was presenting, going back to exactly as it was before COVID is going to take some time. So we just need to be ready for the new normal. That includes choice of physical exercises in school environments. Tending to choose those with less physical contact as much as possible. We know that exercises actually increase exhaling anyway. So we actually need to increase the space. We don't really need to encourage physical contacts because for the sake of having exercises. This, combined with all the other risk reduction measures, should be able to hopefully to take us through this at least initial phase of pandemic until we get a long-term solution. Over.
Okay, great. And Aisha, the question is that for hostel services, and if there is overcrowded schools in rural areas or in many countries there are overcrowded schools, so is there something special which you planned, which has worked for you?
For actually, we have not given a specific guideline, but we ask all the MOHs, they should visit themselves and make sure that the place is good for students, because earlier actually there was no problem because only 3 grades open, but now it will be a little bit a problem because some rooms they are shared and that sort of things, and they are eating in the same place. So we have instructed the medical officer of health to individually visit the hostels and see.
Right. So thank you both of Nafu, and you reminded us that there are local contexts which are important. In what state of epidemic we are, what are the resources available, so how do we reorganize? But the principles remain same, that we have to minimize the infection transmission and but continue to achieve the objectives of health and education in the school and including psychosocial support. So we have taken most of the questions. Thank you so much. And to summarize that, we actually came to know that there are adverse impacts on adolescents. They escape the infection, but they do have a lot of other indirect effects of the pandemic and the lockdowns. So we have to be prepared for new normal. Being prepared is the key. We understood from Aisha that they prepared well with the guidelines, with the IEC materials, with communication. They engaged with community, their stakeholders, and they also engaged with Ministry of Education. So health, education, and WASH ministries, at least they all of them should be together. And then guidelines are available, but implementation is the key. So implement the guidelines well, and then monitor whether there are new infections happening, whether there are school dropouts happening, are the health and well-being monitored or not, are the educational objectives being achieved or not. So all of that is important while we reopen. So be prepared for another surge in cases and another lockdown, and then reopen again. So let us build better. So we build back, but we build better and be more prepared for the next surge, but also for next epidemic, which you cannot prevent or predict. So thank you so much for this knowledge today. All three of you did a good job. Dr. Valentina, Dr. Atnafu, and Dr. Aisha. And there were 128 audience sticking around. So I hope it was useful for them. And thank you for the interactions which you posted in question answer session. So I hand it back to Dr. Neena Raina. Thank you so much.
Thank you very much, Dr. Mehta, for moderating this session and finishing it on time. I would like to, first of all, say a big thank you to Dr. Valentina, Dr. Atnafu, and Dr. Aisha. I think it's a very, very informative webinar, especially most of the people who have kids at home. The offices have opened. People have to go to hospitals or their workplace, but they are not able, the children are at home and there's nobody to look after the children. So school opening, is acting as a double-edged sword also, in the sense that parents feel relaxed and the teachers are also happy. But then there are also, implications of school closures, because there are many schools where the parents are not ready to give school fee. People who, like the drivers of the school buses or school vans, have not been paid. People who run the school canteens, their business is gone. So there are economic repercussions, and in addition to health, social issues, there are huge economic repercussions, especially when the parents are not able to afford the school fee and they're not able to give the school fee either. There are very innovative approaches, and this is the time where education system has come in a big way to use information technology and digital media to reach out to students. I have my domestic help, and she has 4 school-going children. And it's very interesting that they borrow my, mobile, they borrow their father's mobile, and there is a morning 3 hours, they're all busy on their mobile phones because the teachers are taking, and it's a government school, the teachers are taking classes. And then the homework is sent on the mobile, and they sit and copy it, and then they do it. So I see those kids, and they are, at times they do crib that they are busier than they were in the school because teachers are giving a lot of homework to them compared to the earlier days. So I see that there are benefits and there are innovative approaches education system has started to use. And I would say that unless and until, whether it's a health system or education system, there is a sense of preparedness, we should not really open. And Sri Lanka example is a wonderful example where Dr. Aisha, you have highlighted how the preparations were done systematically before the schools were open. And it was not only a political decision, but I think the level of readiness in the system, the willingness, and a regular monitoring later on to see that there are no untoward events, the kids are not sick, the number of cases are not going up. So I think that was extremely important. Yes, I was, I read in the newspaper, and my heart really bleeds for those parents who are losing their kids. There are, after this lockdown, there are a lot of suicide, attempts, and it's primarily because of the lack of connection with the peers. As we know, adolescent is a group which wants to connect with peers and not be always surrounded by parents who do helicopter monitoring all the time. So I see that there are advantages, there are disadvantages, but then advantages are that yes, we need to, it's a huge population, 1.5 billion, as Dr. Mehta said. These learners are affected, but then imagine, the same or maybe more number of people who have lost their, uh, their economic, like their earnings, because they were linked to the school in a big way. But then I think this is the time that some, the countries which have not been able to decide to open the schools need to really look into some of the other innovative approaches to reach out to these adolescents and young people and make sure that they are connected. Their education, like their knowledge and examinations do not suffer, but at the same time also empowering parents and teachers to be able to deliver what they wish to deliver. A really big thank you to all of you, and also to Professor Dilip Mavlankar, who is our collaborator. And I would say that please connect with us for the next webinar, which is next Wednesday. And we are going to be talking about COVID during pregnancy. And it's an area which is still, there are a lot of gray zones, and we would be, sharing some of the experts' advice and where are we in terms of managing pregnancies which are COVID positive, and do we have any evidence that there's a mother to child transmission, and so on. So I think with these words, I would like to say thank you, Dr. Valentina, Dr. Atnapu, Dr. Aisha, and Professor Dilip Mavlankar, and our moderator, Dr. Mehta. Thank you. Have a nice day, nice evening, and enjoy. Let's stay connected. Bye-bye.
Thank you.
Thank you very much. Have a
Thank
nice
you.
day. Bye.
Thank you. Bye.
Bye.